Today, my organization, along with 5 others, are here to ask for immediate action on vaping products. I'm joined by colleagues from the Canadian Medical Association, Quebec Coalition for Tobacco Control, Physicians for a Smoke-Free Canada, Canadian Lung Association, and Canadian Cancer Society. To start, Dr. Sandy Buckman, President of the Canadian Medical Association, will highlight our call to action.
Good morning, everyone. My name is Dr. Sandy Buckman, and I am President of the Canadian Medical Association. We're one of the organizations here today to call for a stop on the marketing of vaping products. At the CMA, we've been working for decades toward the goal of a smoke-free Canada. While Canada has led the way when it comes to regulating the marketing and packaging of tobacco, the same needs to be done for vaping, especially when we know the use is on the rise among teenagers and the long-term health effects are still not known. With flavors like mango and vanilla and flashy displays on convenience store counters, vaping products are appealing to many teens. They're seeing these products, they're curious about them, and they think it's nothing but a harmless habit, that they're not as bad as traditional cigarettes. But we know that many e-cigarettes use salts and flavors to deliver higher concentrations of nicotine than you find in traditional cigarettes because they mask the bitter taste. It's also not currently clear on vaping packages what substances or ingredients these products contain or what chemicals users may be consuming. There's also strong evidence from Canadian and US research that vaping leads to cigarette smoking, especially among teenagers. In short, youth vaping has become a public health crisis, and we need action now. Health needs to be a priority in this election. I echo the call of all our partner organizations in urging all federal political parties to commit to an urgent interim order on vaping marketing. Let's not reinvent the wheel. We've learned many lessons from tobacco control. Wasting time on this can only increase the risks of Canadians. Thank you. Merci.
Bonjour, mon nom est Florie Douka. Je suis co-directrice et porte-parole pour la Coalition québécoise pour le contrôle du tabac. Merci, Dr. Buckman. Il importe de retenir que les grands progrès pour réduire le tabagisme chez les jeunes se sont faits en créant un environnement qui dénormalisait la cigarette et son usage et rendait les produits beaucoup moins attrayants pour les jeunes. C'est justement l'approche qui devrait être préconisée pour réduire le vapotage chez les jeunes. Unfortunately, the Tobacco and Vaping Products Act, which legalized the sale and promotion of vaping products with nicotine in Canada in May 2018, treats tobacco products very differently from vaping products. Whereas tobacco advertising is only allowed in adult-only venues and through publications sent to a named person, advertising for vaping products can be placed anywhere and can be broadcasted widely. This promotion of vaping products has also exposed our youngsters to the buffet of fun, fruity flavors found in e-liquids. Undoubtedly, these factors have contributed to trivializing the inherent risks associated with the use of nicotine in vaping products. Bien que certaines provinces ont des mesures qui sont plus restrictives que l'encadrement. Back when Bill S5 was being studied, the very bill that legalized these products, we were told that Health Canada would respond promptly through regulations if the need arose. We've been in a crisis since the previous school year began, September 2018, when high school principals across the country began to complain about the spike in youth vaping. 1 year and 3 consultations later, no such regulations have been implemented. Alors que nos voisins des États américains commencent à interdire la vente des produits de vapotage aromatisés, nos propres chefs des partis politiques semblent vouloir s'engager dans des actions qui ne sont pas immédiates et dans rien de concret. N'est-il pas temps pour des actions immédiates?
I'm Cynthia Callard. I'm the Executive Director of Physicians for Smoke-Free Canada and a veteran of the tobacco struggles. When big tobacco, big nicotine entered the vaping market last year, it felt like open season had been declared on Canadian kids. Vaping products were suddenly sold everywhere. Beforehand, they were only sold in specialty boutiques, but now they're sold in every convenience store. Vaping devices were reinvented. Before, they were bulky, awkward, cumbersome tank systems. Now, small, sleek models with disposable iPods. So easy to use, so easy to hide from parents and teachers. Vaping devices became cheap. Before, they were the price of a pair of sneakers or concert ticket. Now it's about the same cost as a pizza, or sometimes even free. E-cigarettes became stronger. Last summer, the maximum amount of nicotine in an e-pod was about 18 milligrams per milliliter. Now it's almost 3 times as high, approaching 60 milligrams per milliliter. The nicotine was reformulated. Starting last August, products were sold where the molecular structure of the nicotine had been tinkered with by adding salts. The result was a faster, more powerful drug experience. The addiction was candy-coated. Nicotine was sold with kid-friendly, healthy-sounding flavors: peach swirl, red kick, crisp apple, fresh berries. No promotional expense has been spared. Television and radio ads, large signs behind cash registers, decals on gas pumps, special offers, free giveaways, Instagram and web feeds, festivals, influencers, and brand activators. In short, tobacco companies are hooking today's kids on vaping products with the same tools they used to hook their parents and grandparents to cigarettes. Make them trendy, make them ubiquitous, make them affordable, make them addictive, make it easy to start. The interim order that we are proposing would protect Canadian kids from these marketing tactics. It would protect them now when they need it, not next year when it will be too late for some.
Bonjour, good morning. My name is Terry Dean. I'm the President and CEO of the Canadian Lung Association. Our organization is very concerned about the alarming trends associated with vaping use amongst youth and the emerging evidence recently about the impacts on lung health. While we still have much to learn about the long-term health effects, there's enough current evidence today to say that this is not a safe product. It is a product that we need to ensure is properly restricted. Most vaping products contain nicotine, which is a highly addictive drug. Nicotine use may lead to a lifelong struggle with dependence and may act as a gateway to smoking traditional cigarettes for young people. The health impacts of smoking have long been documented and remain the leading cause of death and disability in Canada. We cannot risk reversing the progress that has been made on tobacco control by addicting a new generation. Likewise, the aerosol from vaping products is not harmless. Some of the chemicals in vaping products have been shown to cause cardiovascular disease, lung injury, COPD, and certainly an exacerbation of people who suffer from asthma. In the United States, several cases of pulmonary illness and death have been reported as a result of vaping. I'm sure you heard the news from London yesterday. We do not need to wait for a death in Canada to warrant action to protect the lungs of Canadians and ensure everyone can breathe with ease. The time to act is now. Thank you. Merci.
My name is Rob Cunningham. I'm a lawyer and senior policy analyst with the Canadian Cancer Society. There needs to be an immediate interim order under the Department of Health Act to reduce youth vaping. There should be restrictions on e-cigarette advertising similar to existing restrictions on tobacco advertising. There should be a ban on all additives and flavors unless specifically authorized. And there should be a maximum nicotine level, as we've already seen in the European Union. In short, there needs to be an immediate interim order to reduce youth vaping with measures on advertising, flavors, and nicotine levels. C'est nécessaire d'avoir un arrêt d'urgence pour réduire le vapotage parmi les adolescents, avec des restrictions sur la publicité en faveur de la cigarette électronique, comme on voit pour le tabac, une interdiction des ingrédients et saveurs, sauf qui est spécifiquement autorisé, et un taux de nicotine maximum, comme on voit dans l'Union européenne. C'est nécessaire d'avoir un arrêt d'urgence pour réduire le vapotage parmi les adolescents avec des mesures sur la publicité, les saveurs et le taux maximum de nicotine. Merci.
As illustrated by my colleagues, we're at a crossroads in Canada. Our organizations have shown the existing regulatory environment to be insufficient in protecting young people in Canada. Vaping rates among youth are skyrocketing, and we're seeing associated health problems, such as respiratory conditions, both here in Canada and elsewhere in the world. We need immediate action and commitment by all federal parties to create restraints in a system where marketing is rampant. Youth are being enticed with attractive and fun flavors and hooked on harmful products that don't have the necessary health warnings or safe nicotine limits. Will we allow a new generation of young people to become addicted to nicotine and at increased risk for health problems? Or will all political parties commit to using an interim order within 60 days of forming government and address this problem head-on? Thank you, and I open the floor for questions.
I think I mentioned this to you yesterday, but the gentleman I met on the street who said he was a heavy smoker and he vapes now and he's much healthier. So is there a balance to be found between, who said he was a heavy smoker and he vapes now and he's much healthier? So is there a balance to be found between, smokers who are transitioning using vaping to transition out of smoking and youth vaping?
Yes, there does. No one's proposing a ban on e-cigarettes. E-cigarettes are intended for adult smokers unable to quit, but we're having skyrocketing rates of youth vaping. And the regulatory controls that we have in Canada are much less than we have in other countries. There's no reason to have advertising for these products that kids are exposed to on billboards, on television, on social media. That's an easy change that could be made. Similarly, with respect to nicotine levels, the European Union does have maximum nicotine levels, and they find a balance with respect to the regulation that we don't have in Canada at this point.
The same gentleman told me he thought that there's a bit of a panic going on right now when you compare smoking rates and the number of smoking deaths a year to vaping, which is our first confirmed case in Canada. Is there a panic happening here?
I think it speaks to the concept of not reinventing the wheel. We've been here before in trying to get control of tobacco products. And we need the same kind of promotion and regulation that we did for tobacco over the years that really worked, particularly in the early part of the 2000s. We saw that restricting promotion and marketing to youth really made a significant difference in decreasing smoking rates. So we're calling for the same thing here. We just have to reduce, we're not calling for an outright ban, as was just mentioned, but we really have to reduce the promotion and marketing to youth so we don't see those increased health risks that are associated with vaping.
Une question en français. Vous demandez au gouvernement fédéral de mettre fin au marketing des produits de potage et sinon, pourquoi?
C'est pas une interdiction complète du marketing, c'est un alignement des dispositions de marketing sur celles du tabac qui sont quand même beaucoup plus restrictives. Ça permet un marketing qui est beaucoup plus ciblé à des adultes, puis notamment à des fumeurs. Et c'est justement les seuls qui peuvent bénéficier de ces produits-là. Donc, s'il y a un équilibre à aller chercher...
We had a ban on vaping products in Canada, but we still had vaping stores in almost every neighborhood. It was a gray market. It was a tolerated gray market. I think one of the reasons it was tolerated, although this was never made explicit, was because of some Supreme Court rulings that had been made that were addressing the potential for harm reduction and the right of an individual to have access to a product that could potentially benefit them. So we do not want to go back to an illegal gray market. We would prefer to have a properly regulated market that is within, that everyone's operating within legal, health-directed regulations.
So just to ask off of that, so that's why you're not asking for a ban, a full-out ban on this? Because there's you're asking, right, restrictions on advertising, a ban on the flavors, bringing nicotine levels in line with the EU, but why not an outright ban?
It's, I think for decades we've been asked why not just ban cigarettes. And I think if we thought this would be an effective public health strategy that would actually arrive at what our desire, which is reduced use, minimized use, maybe end of use, we would be advocating it. We don't think at this point that substituting a commercial market with a black market will achieve those public health goals. If the evidence changes that a ban would be effective at achieving that, then you might find us calling for something different.
Can I ask, obviously your stakeholders at the table with the government. What's been the holdup from your side in working with government to actually get any regulations in place? What's been the holdup for a year and 3 months?
There's a few issues. Obviously, surveillance data is one of the big problems. We don't know how big the problem is. This thing has evolved very quickly over the last several months. One thing that would occur with the restriction is that we would start to gather evidence to understand what is usage, where are these issues. Hospitals will start reporting when they have the incident showing up. So we have to start to do our surveillance data in order to inform policy. Today it's lacking, so we're thinking we can work our way into this, but we have to start immediately to start gathering the data to inform policy, to inform action subsequent to this.
You believe that 60 days? Oh, sorry, go ahead, sir.
Just so we're clear what the action actually does, you're asking for an interim order under the Department of Health Act. Does that address the three things? Does that one order address the three things that you did, the vape, the flavors, the nicotine level, and the marketing?
It can, and to your point and question about the delays, the consultation process can be time-consuming, but we're seeing swift action elsewhere in the world, recognizing that this needs immediate attention. And an interim order can be used, and that would be regulations that could be in place for 12 months up until we get more permanent regulations in place. But we see a problem now, it can be addressed immediately, and the consultation process can happen in the background, but we need something to protect youth in Canada right now. We can't wait and have further delays.
And just to add, I think there's an increasing recognition by governments of the urgency to take action. In June, there was published a study in Canada that found that youth vaping increased by 74% in a single year among 16 to 19-year-olds from 2017 to 2018, before and after e-cigarettes with nicotine were legalized in Canada and promotion began. In the United States, they've just released the first 2019 data showing yet a further spike. Approximately 11% 2017, 21% in 2018, 27% in 2019 among high school students. So it's going up. We're very concerned about what the data may show in 2019 in Canada, and that's why it's essential that governments move as soon as possible. And just to elaborate on a previous question, la promotion et les étalages dans les boutiques spécialisées pour adultes seulement ne sera pas interdite. Donc, on pourrait avoir encore de la publicité comme ça. There would not be a ban on advertising or promotions in adult-only specialty vape shops. That would still be able to continue.
Je peux vous demander en français de dire ce que vous venez de dire en anglais sur le fait que c'est de plus en plus populaire.
Of nicotine that you're targeting?
So in terms of the flavors and additives, it's very much based on the approach that's used as part of the Federal Act for Tobacco Products. The idea is to ban everything except what's explicitly permitted. That's what we do for flavors in tobacco, and that's why we don't see flavored cigarettes or cigarellos anymore. In terms of vaping products, we expect that some additives or some flavors might be allowed, for example, tobacco flavor for vaping products. We expect probably some of the additives that are known not to be necessarily particularly problematic. We know that some of the additives currently in vaping products are particularly problematic, known to be serious irritants to the lungs. And so in that sense, the idea is just to go with a precautionary principle, and we expect that once we have this interim regulation in place, further studies, further consultation, and in time there would be a safer and more effective framework that would be established. In terms of the nicotine content, 20 milligrams per milliliter is the European directive. It's been enforced now for a number of years. Their vaping products are sold there, and just to add to something, one of the most promising clinic random trial in terms of cessation for vaping products used a dose that was 18 milligram per milliliter, and so it's quite obvious that we don't need these very high doses in the market when we're talking of non-therapeutic products. Again, the vaping products that are being sold on the market that we're trying to target that are encompassed as part of this of the current act have not been been certified as medicines. Any manufacturer can go and use the other regulatory process to get their products certified as medicines for cessation. Nobody's there to stop them. You're allowed to promote those products. And you know, there's efficacy trials that need to be done. And in many cases, most provinces, both public and private insurance will cover some of the payments for that. So it's beneficial for smokers. One has to ask themselves, why isn't the vaping industry now going the certified medicine route?
Just a question. Does anybody know anything more about the recent case in Canada?
We aren't aware of any information more than what I think everyone else is aware of that's been in the standard press. It's the linking of vaping products to the potential for serious lung disease that is the concern. It raises a red flag, just as the several hundred cases in the U.S. plus the 6 or 7 deaths. So that's why we're all concerned, because there are definite health risks associated with vaping. It can lead to addiction, right? It can be a gateway drug for nicotine. Some of the other health consequences include of vaping include the adverse effects on brain development, particularly in youth, on pregnancy. It does have risk of cardiovascular disease. It does have risk of lung disease. And in addition, there's evidence that suggests that it also can affect the mucous membranes of the mouth and other tissues that lead to biologic changes that are linked to cancer. So we're raising this, and this has to happen now. Again, we have long experience with tobacco and tobacco products. So I think it's really important to take the prudent, cautious approach and get the interim order in place so that we can undertake appropriate policy and regulation.
Do you know if cannabis would make things worse? I mean, if someone was vaping
If
doing
cannabis?
yeah, I'm just,
Well, again, we referred to the earliest. We had this gray market in vaping products. We had this gray market and illegal market in cannabis, and now it's been regulated. We're calling for the same thing with vaping products.